Hello, welcome to Traditional Chinese Medicine Asthma. My name is Christina Kapothanasis. I am a licensed acupuncturist here in the state of Hawaii, and I am certified in acupuncture and herbal medicine under the NCC-AOM, or the National Certification Commission for Acupuncture and Oriental Medicine. I'm also the executive director of the Hawaii Oriental Medicine and Acupuncture Association. Today I'm going to be sharing with you a little bit about asthma and how traditional Chinese medicine looks at asthma. The diagnostic methods, the treatment methods including acupuncture, herbal medicine, acupressure, and some nutritional recommendations. Western medicine looks at asthma as a type of disease characterized by airflow obstruction. So it's aiming on the airflow with slight inflammation due to different allergies or triggers. Now those triggers can be a variety of different triggers, from cold weather or hot weather to different environmental allergens like pollen, also things like perfume or different kinds of house disinfectants. Virus or infections can trigger asthma. A common cold can lead into an episode of asthma. And different drugs or stress in your life can also trigger asthma. 10 to 12% of adults have asthma, and approximately 15% of children are affected with this disease. Traditional Chinese medicine looks at the same kinds of symptoms that patients report: coughing, wheezing, difficulty breathing, also tightness in the chest, pain, a dull ache pain in the chest. And right before an episode, patients may experience some sneezing or itchy nose, knowing that the cough is coming. Patients also may present with phlegm, coughing up phlegm just in the morning or during the day. Every time they cough, different amounts and different colors and different qualities of phlegm, which traditional Chinese medicine definitely focuses on, because we break asthma down into several different kinds of asthma. We call those different kinds of asthma syndromes or patterns. And what we're looking for are indications about weaknesses in different organs. The main organs associated with asthma are, of course, the lungs, and we have also the spleen, and finally the kidneys. These three organs are the main organs associated with the disease of asthma because they regulate the water flow in the body. And this water flow also will include disrupted water metabolism leading to phlegm or mucus. When we look at treating asthma from a traditional Chinese medicine perspective, also we have to think about if they are in an asthma episode right now. Are they coughing and wheezing at this time, or are they in one of the calm stages between episodes in some kind of remission? We treat these two cases differently, obviously. When a person is coughing and wheezing and sneezing and lots of phlegm, we need to control the cough first and control the phlegm. And when the person is a little bit more calm and the cough has calmed down a little bit, we need to focus on building up the organs of lungs and or spleen and or kidneys wherever the deficiencies may arise. In Chinese, we have a saying that says, 急则治其标, 缓则治其本. So this is just the idea of when the symptoms arise, we first get those under control, and when those symptoms are under control and the patient is stable, then we work on building up the body, something like building up the immune system to prevent further outbreaks. Some of the syndromes that I'm going to share with you today are hot kind of asthma, a cold kind of asthma, and also an asthma where the cold is on the outside, encasing or enveloping the heat on the inside. These three patterns of asthma are when an episode is triggered and the patient is coughing. We also have two or more kinds of asthma when the patient is more stable. We focus on a lung and spleen deficiency of qi, and we also focus on a lung and kidney deficiency, either of a yin or yang nature. So if we talk about those one at a time, we'll first focus on the cold asthma. In addition to the regular symptoms of coughing and wheezing and difficulty breathing, tightness in the chest, we will look at the quality of the phlegm. The phlegm in a cold asthma patient will be white versus yellow. White indicating cold, yellow indicating heat. We can also look at the quality of the phlegm. It should be a little bit more watery, and it also may have little frothy bubbles in it. If we look at the different cold symptoms in the body, we can see that the patient may not be thirsty. People who are always thirsty, sign of heat. If they're not thirsty, maybe they have to force themselves to get liquid down during the day. This may be a sign of cold. Patients may be sensitive to cold weather or air conditioning, and this may be one of their triggers. People who go into work in the morning in a cold office and start coughing from the air conditioning may possibly have a cold kind of asthma. Also, these patients may have urination that is quite clear, almost like the water that they drink in. It goes right out of them, and they may have a lot of urine at each time. We also look at the tongue and take the pulse. These are two very important types of diagnosis in Chinese medicine. These diagnostic methods can tell us a lot about what's going on in the body. If we look at the cold asthma patient's tongue, we will see that the tongue may be a light color and the coating will be thicker than average. We would like a thin white coating on normal tongue, but these patients may have a thicker white coating. It may be quite moist and watery. If we look at the pulse, we take the pulse, the radial pulse here with 3 fingers. We take it on both sides telling us different things about the body, but the pulse in general will be quite tight, like pulling a string or rubber band taut, and this kind of jumpy, tight motion. This is how a cold asthmatic patient's pulse may feel. On the other hand, if we have hot asthma, we're going to look at the phlegm being a little bit more yellow. As we mentioned, yellow will indicate heat, and the heat is going to burn off some of the fluids in the body. So we may see the phlegm is a little bit stickier in nature versus the watery white phlegm of a cold asthma patient. They also may be a little bit thirstier and have a drier mouth. We may also see signs of constipation and possibly a bitter or sour taste in the mouth. Bitter or sour taste in the mouth can happen right when you wake up in the morning, or they may happen sometime in the early afternoon. That's the 2 most common times that the bitter taste or sour taste can appear in the mouth. These patients may also have their asthma triggered by heat, so possibly their asthma may be more severe in the summer months. And patients may present with slight constipation, either difficulty going or the stools being a little on the hard side or even pebbles. Their urine may also be a dark color, more like a tea color versus the clear, almost watery color of a cold asthma patient. If we look at the pulse and the tongue, it's going to vary differently. We have a light tongue color for the white, for the cold asthma, and we're going to have more of a red color indicating heat for a hot asthma. We also are going to look at the coating color. We'll probably see a slight yellow coating, which indicates heat, and that coating may be thicker or thinner depending on the severity of dampness in the system. Dampness being a kind of sticky condition, which we don't want, sticky like phlegm condition in the body. If we look at the pulse, we may see that it's quite faster than normal, fast also indicating heat. And we may still see a little bit of the tightness, but we separate xuan and jin. This jin is a little bit tighter and possibly deeper with the cold asthma. So we're looking for the fast pulse, faster pulse than average for the hot. Now for the patients that have a layer of cold sort of outside and the heat encapsulated inside, we call that han bao re. The cold is hugging or holding the heat inside. These patients may have more of white phlegm with possibly a tinge of yellow. And they may also be sensitive to cold. So if they have an aversion to cold and white phlegm, we can see some of the colder symptoms more on the outside of the body. Now on the inside of the body, they may suffer from constipation or the thirstiness from the heat burning off the fluids, and they may have some kind of irritability, not feeling as calm as they normally do. If we look at the tongue, we'll also see a combination of hot and cold signs. The tongue may be nice and pink across most of the tongue, but at the tip and sides of the tongue, it may be a little red. In Chinese medicine, the tip of the tongue represents the heart and the lungs. So there may be some internal heat, and the lungs represented with the red tip on the tongue. If we look at the yellow coating, at the white coating, we may see again a tinge of yellow, but mostly the white, the cold, maybe just starting to turn heat with a tinge of yellow. Their pulse may also be tight and like the rubber band, 宣 and 紧. Now these are the three types of asthma that we would try to differentiate between when the person comes in coughing in the middle of an episode. After we get the symptoms under control, and possibly at the same time working side by side when they have the cough, we're going to be working on building up their organs. So the first kind of patient will be more of lungs plus spleen deficiency, and another type may be more lungs and kidney deficiency, and some patients may have deficiency in all three. These three organs are sort of inseparable, each affecting the other in different ways, so we can sometimes see deficiency in all three organs. The spleen deficiency causes asthma affecting the lungs in the way that the spleen digests your food. When the spleen is weak and it doesn't digest the food in the stomach properly, then we get this kind of sticky condition like the mucus or the phlegm that patients are coughing up. In Chinese medicine, we say that the spleen and stomach are responsible for producing the phlegm, and the lungs are responsible for holding the phlegm. So the lungs are the containers for the phlegm. And that phlegm can be anywhere in the respiratory tract, from some kind of postnasal drip to a constant phlegm bothering people in their throat when they're constantly trying to clear their throat, to coughing phlegm up directly from the lungs. These patients usually feel quite fatigued. They may have a poor appetite. They may have loose bowels, loose stools, and their phlegm, when they have it, is usually a little bit more watery. They may have a low immune system where they're easily predisposed to catching colds. They may have a few colds throughout the year, or they may be constantly going in and out of one antibiotic onto another from cold after cold. These kinds of patients will also have something called spontaneous sweating. Spontaneous sweating occurs when your qi is very weak, and maybe you are just doing some light housework, or you're taking a walk around the park, and you just all of a sudden break out in a little sweat. It's not quite the same as hot flash, women going through menopause, but it's a kind of a little sweat throughout the whole body, and it's caused by qi deficiency. If you experience this kind of sweating, it's called spontaneous sweating in Chinese medicine, and it is explained by qi deficiency. These people may also be sensitive to drafts or windy conditions. If we look at the tongue, it might be a little bit light in color, and if we look at the pulse, it might be a little thinner than average and a little weaker. When we press down, it doesn't have quite as much strength to it. The other kind of deficiency would be resulting from kidney deficiency. So the kidneys are responsible for grasping the qi. People with kidney deficiency, their breathing is more concentrated in the upper part of their lungs and shallow, and they can't take a nice deep breath, expanding their lungs and feeling like they can fill up their abdomen with air. So this idea of not being able to get a good, full, deep breath is the idea of kidney deficiency. San bu na qi, we say. The kidneys aren't grasping the qi and bringing it down fully. These patients may also present with some other kinds of kidney deficiency symptoms, including tinnitus, or that buzzing, ringing in the ears. They may have dizziness, dizziness upon standing, and they may suffer from lower back and or leg soreness, an achy kind of feeling all the time. These people, we also have to differentiate if it's more of a kidney yin deficiency or more of a kidney yang deficiency. Kidney yin deficiency being something like dehydration, not enough nice moisturizing fluids in the body, leading to heat signs, and yang deficiency translating to something similar to the idea of not having enough warmth or qi or energy in the body, and leading to cold kind of symptoms. So these patterns we will try to differentiate and boost whichever that particular patient requires. A couple cases that I've been treating recently. There's a 50-year-old woman that has come in with asthma. Her asthma was quite severe when she started. She was on over 13 different kinds of medications, coughing incessantly day and night, disrupting her sleep, phlegm all day, all night long. She also had a tightness in the chest. There was constant dull ache. She had tinnitus, or the ringing in the ears. Her cough was triggered by everything. I even gave her her first batch of herbs to take home and brew, and just the process of brewing the herbs triggered her cough, so we had to change her to powder. She also suffered from acid reflux and hot flashes, frequent urination. She had urination approximately every 20 minutes during the day and almost hourly at night after midnight. After she started on acupuncture, after a few weeks of treatment, her coughing was basically under control, and her tightness in the chest was gone, as well as her acid reflux and hot flashes. We've gotten to a point now that her frequent urination during the day is under control, and at night she's down to 2 times. Her pulmonary test is good. Her sinus CAT scans are good. Along the way, she's lost 15 pounds, and her cholesterol is down from 212 to 166. She's also free of the pre-diabetic label. Another case that I've recently started on is a 7-year-old girl who's had asthma since she was 3.5. The first time I saw her, I was treating her mother first upstairs, and I heard a little girl coughing constantly. So I thought, oh, she's definitely got a severe case. She was on 5 different types of medication when we began, and she also suffered from itchiness of skin and insomnia. She had a hard time falling asleep. She also had constipation in the form of pebbles. After about a month of treatment, we are down to 2 of the 5 medications, and we are cutting those down in half. The constant coughing is down by 80%. I give her a scale of 1 to 10 to rate her cough on, 10 being the worst. And our last treatment, she said she was down to a 2. She is falling asleep fine now. The wet cough has turned into a mild dry cough, and her stools are back to normal. So I'm very proud of both of these patients. They also make dietary changes and changes to their lifestyle. A couple of those things that I would like to share with you today. Herbs and nutrition. For the herbs and nutrition part, we're trying to eliminate some of the inflammatory conditions in the body. So I usually tell patients to eliminate wheat products, wheat and white flour being the same, whole wheat flour and white flour, dairy products from milk and cheese and the such and the like, sugar and different things that would irritate the stomach, like acidic things, oranges, vinegar, and tomato. Some of the herbs that we may use are things like baizu. This is going to help build up the digestive system and take care of some of the phlegm It's going to build the qi. The tenpi and bansha will maybe help take care of some of the colder phlegm. If we have a hotter kind of phlegm, we'll need to add some cooling herbs. So things like bai hui and nansha can not only moisturize the lungs, but nansha can also transform phlegm at the same time. Bai hui is good for moisturizing, stopping the cough, and these warmer herbs can be used in conjunction with the cooler herbs. It depends on everybody's specific condition. Also, if we have the kidney deficiency kind of pattern, we can use an herb like shou-di, which is going to be good for building the liver and kidneys, and dangui is good for moisturizing the intestines, building the blood, and stopping cough. These two herbs were the crucial herbs for the 7-year-old little girl. These really did the trick to bring her cough way down. I have a friend today who is going to be our model. We're going to show a couple acupuncture points. Welcome Nathan Zen. He's also an acupuncturist here in the islands. And if he would like to lie down for us, I will show a quick demonstration on a couple points and show you some points that you can try at home. If you're coughing now, some of the points that you can try are located here on the arm and on the legs. So I'll demonstrate the arm on myself. If we come and try to find this little protrusion on the bone right behind the wrist, come directly inside of that. This is a point called Tai Yuan. This is helpful for building up the lungs. If we go right behind that a little bit, coming right directly in and back a little from that bone, this is called Zhao Hai. This is excellent for stopping the cough. So if you are coughing and you need to build up the lungs, you can go right between these 2 points, pressing like this, a few minutes on each point per day. If we come down to the ankle, starting on the ankle bone, go right below it into the little depression here and press down. What we're looking for is a nice sore feeling. The sore feeling is the key to knowing that we got the point. And this point and this point, Zhao Hai and Tai Yuan, work in conjunction. They're a very strong pair for eliminating and controlling the cough. Tai Yuan good for building the lungs. Zhao Hai also good for building the kidney yin. And if we take a look on the side of the leg here, we can also build up the digestive system, the spleen and stomach, by coming down approximately 1 hand width from the knee. You can feel a little bit of a dip on the tibia here, and it's right outside the bone. If you press in here, you should feel a nice sore feeling. And this one may be a little bit harder to get to by yourself, but just press in here until you feel a nice sore feeling, and this will be great. This is a good point for anybody to help keep their digestion and qi, or energy, strong. Today we're going to do a couple points on Nathan to demonstrate what an acupuncture session might look like. First, we disinfect with alcohol. And we will be doing a few of these points for you today. All the needles are made out of stainless steel and are disposable. We put the needle in until you feel a little bit sore sensation. Then that sore sensation will die down in a couple seconds, and while we leave the needles in for approximately 20 minutes, you shouldn't feel anything. Zhu San Li, again for the digestion. Building up the qi. As long as your qi is strong, there can be no phlegm being made that's stored in the lungs. If we come up to his abdomen, we will do a point again for the digestive system. Strong digestive system, trying to eliminate any of the phlegm. This is called Zhongwan. It's the stomach point on the abdomen. And we're doing a point on the lower abdomen called a qi hai. Qi hai is the sea of qi, that's how it translates. And this is working on helping the kidneys grasp the qi. If we come over here to the wrist, we have the pointed jiao hai, which I was just demonstrating for the acupressure. If we did Tai Yuan, it would be slightly in front of that. This point will be good working in conjunction with the one on the kidneys to stop the cough. And I will put in the other side for him. We always put the needles on both sides. And this will be a nice sampling of some of the needles that we may use in an average treatment. Jiao hai, Zhu San Li, Zhongwan, Qi hai, and Li Qi. So thank you. This will include our session today on asthma. I hope that you can take some of the tips on the nutrition, trying to cut out the wheat and dairy in your diet, oranges, vinegar, anything acidic that would be inflaming or aggravating the digestive system, and try some of the acupuncture points in the form of acupressure, massaging them for a few minutes each day, and see if you can also gain some benefits from the practice of traditional Chinese medicine. If you have any questions, you can call the number on the screen or email. There's an email address at the last page. Thank you so much for joining us today, and until next time, mahalo.